Hello everyone, welcome to our live session today. I will be going over a quick startup presentation to welcome you all and introduce you to our program and opportunities if you have not previously attended our shadowing session. So Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic, status, abilities, or location. My name is Muntaha and I am the editor-in-chief here at Pre-Health Shadowing. Thank you all for attending today and let's get started. So just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen. If you need assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive, ensure our sessions are accessible to everyone, so please, if you have any recommendations for how we can improve, you can always email us at info@prehealthshadowing.com. So since this is an international program, we want to know where you are Zooming from. Drop in the chat your location and say, I'm calling from. It's wonderful. We have a lot of people from around the country. Pre-Health Shadowing is based in California, by the way. Great. So if you want to stay in the loop and follow us on our social media, we are active on Instagram, TikTok, or sign up for our email list on our website to never miss a session. We have some wonderful opportunities for you all as benefits being part of our program. We have partnered with Kaplan to get our students a 10% discount code that can be used on all Kaplan products, as well as free resources such as study guides to help prepare you for standardized testing like the MCAT, NCLEX, or PCAT. If you fill out our short survey in the chat, we will get signed up for these deals for free. We would also like you to draw our attention to another amazing program we have. Mask for Mask is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without proper PPE, others who are struggling to stay safe. So with our discount code PHS15, you can get 15% off your order. If you buy through this method, Pre-Health Shadowing will also get 10% of the proceeds, which is amazing because we are a nonprofit that runs solely off of the support of our community. If you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers, team members. You can apply to be a part of our administrative team and lead students in various projects, initiatives with professional outreach, grant writing, and more. We understand that as pre-health students, you may not have the time, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be a part of this program and contribute your unique perspective. If you are a high school student and want to get involved, we have a program called HTP, High School Training for PHS, which allows you to connect with college pre-health programs and get involved in fundraising for PHS. So you can organize resources for other high school students interested in medicine through pre-health shadowing. We want to recognize the hard work of all of our students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to the editor-in-chief, which is myself, through the link dropped in the chat to have our work on the website. This will look great on CVs, applications, resumes, etc. So take advantage of this, and I look forward to reading your submissions if you happen to submit anything. Part of our mission at PHS is to promote diversity. In order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID roundtable, and international student forum. If you have a mentor, professor, or professional that has inspired you and you think they could contribute to these conversations, nominate them today using the link that is going to be dropped in our chat by one of our team members. If you can, we humbly ask that you donate to our program. As you know, pre-health shadowing is completely student-run. We are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you are not financially able, we request that you send this link to someone you think of, so if they can continue to support us, so we can have everyone afford these opportunities. Throughout the session today, we encourage you to drop any questions you have for our professional in the chat. Our team members will be making note of all of these questions, and we will be answering them in the latter half of today's session. Make sure to take good notes as our professional is going over their presentation, as there will be the chance to take a post-shadowing assessment to verify your virtual shadowing hours. More information on how to take this quiz and get your hours will be at the end of the session, so please stay tuned. Lastly, if you can, we request you to turn your cameras on. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. I appreciate you for listening, and now I would like to welcome our professional. Thank you so much for joining us today, Dr. Chen. You may share your screen whenever you are ready.
All right, thank you everyone for holding this session, and thank you for all those who are joining today. I'm sure it's I'm on the East Coast, so Pacific time is 3 hours away, but let me see how I can do that. Okay, great. You guys should be able to see my screen. Okay, now, can you all see my screen?
Yes, we can.
Right. So I'm going to dive right into it. I mean, I'm going to keep it brief and simple only because I think that I would like to open the floor up to many people who are interested in dentistry, right? So let's put it this way. I want to call this Dentistry 101. And the reason why I say Dentistry 101 is because I think that we focus so much on dentistry as a concept, as an industry, and versus understanding why others have gone into dentistry. As far as me, I have gone to dentistry for other reasons, and I'm more than happy to share that with you all. Okay, so life is very interesting, right? Life is kind of like a maze. I can only describe it as such. This is a clear maze, and I feel like we are all human experiments in a maze. We're all trying to find our way out, and oftentimes we get lost in the process, right? And especially with dentistry, people think we just work with teeth, but it's just beyond that, and it's more of a human touch behind why dentistry is such an extravagant profession, to say the least, right? So I want to give you a little brief background of who I am and where I came from. I went to school at NYU. I graduated with a degree in economics, and I went soon immediately after. I went to Columbia for dental school, and I graduated in 2016. And soon after, I did a 2-year GPR at the Bronx VA, and I graduated 2018. So I'm not sure the average age that is in this room today, but it is nice to know that I'm still relatively young. I'm of course in my 30s now, so it's a little different, but age or not, it's important to know where we are, right? So I want to kind of preface this by saying that, even though I was an economics major, I still pursued dentistry for other reasons. I think that science, like when I first went to dental college, I was in a biology major, and soon after I changed to economics for other reasons, because of my personal preference for economics and this sort of business side of things. So again, you don't have to necessarily pursue a degree in science if you want to go into dentistry or any sort of healthcare profession. I think it's nice to explore sort of majors that you're interested in learning, because that's 4 years, and then when those go, you go to healthcare professional school. That's another couple of years that you may not be able to retrieve. So I'm a huge proponent of being non-traditional. So I want to kind of dive right into kind of sharing what dentistry is all about. I think we often talk about dentistry, but we don't see dentistry as as a profession in which we can actually make changes in people's lives. And I want to show you some of the things that personally for me, I felt to be very accustomed to and in tune with. Now, so let's start from dental school. And this is where I think when I was in a couple of years back, at least 7 years ago, this is the class, one of the cases that I had worked on. And you can see from here to here, there's a lot of differences here. You see, you kind of see the crowns that are, let me see if I can get the laser pointer. There we go. Yeah. So you can see kind of this area here that's kind of inflamed around the gum area and aesthetically unpleasing. For me, the before and after, this after is not aesthetically pleasing because you can see this kind of this length of this tooth is, you know, a little longer and this is a little shorter and so on and so forth. But again, if you're in dental school, you know, you're trying a lot of different things and you're not so sure how the direction of your, you know, your treatment's going to go. But from dental school, you can achieve great outcomes such as to here, right? Within a 3-year time frame from here to here is how I have improved my dentistry. Now, here's one of the cases I have done that took me 1.5 years, a full mouth reconstruction case, sinus lift surgeries, you know, you name it, crowns, veneers, implants, everything, to fully reconstruct his smile. And it took a long time, 1.5 years of reconstructing his smile. And I'm finally able to be proud to say that I was able to deliver an aesthetic result after that long. And dentistry isn't always an immediate sort of solution, right? Dentistry takes time. It takes time to plan and vice versa. So you can see this left side took 1.5 years. On our right side, it took me 1 hour, where this guy was having a wedding coming up and he chipped his tooth. He emailed me at 10:30 and I was the only person who was able to provide a result and said, hey, I have some time tomorrow. Come on in, I'll fix you up. All right. So he has an engagement photo shoot. And why make him look like this when I can make him look like this? So it took a little bit of time. And the science behind it is hard, right? If you think about this, you could look at this black background that I have here. You can see this kind of halo of gray that shows through from his current existing or previously existing restoration. When I call restoration, that's like a bonding. And you can see that he's chipping away his tooth. And suddenly one day I decided we got to change you up. So I lengthened it, added a little bit areas of, you know, length, and again, try to mask that black background because of the smile. And I was able to achieve a result in 1 hour. So I was pretty pleased with the results. Personally, I'm always trying to improve every day, every hour when I'm working. But so this is what dentistry can provide. We can make immediate changes or we can make changes long-term. And dentistry is weird and it's nice because we should be thinking long-term, not immediately, right? Another case where I had a patient come in and had a little, you know, slight yellowish hue around her previous existing bonding, and I removed it, applied a new one, and here we go, brand new. Even here, a full mouth reconstruction of 24 crowns, almost a whole entire, actually it is a whole entire mouth full of crowns. Again, it took me 1 year to establish this. Is it too yellow, too white for my personal preference? Absolutely. But that's what he wanted, a full mouth reconstruction. So a little bit about where I came from, because dentistry, as much as we are doing dentistry, forget about the story behind how we get to where we are. And I will tell you, when I first started in 2016, I was a resident and I continued to become a resident until 2018. I was also working as a doctor at Fort Lee, New Jersey, moonlighting. When I say moonlighting, people are resident and also working prior practice. At the same time, I also co-founded a tech startup. So it's crazy. I've been doing a lot of stuff, doing business, doing startups, entrepreneurial lifestyle, just trying new things all the time. That's 2016, 2017. After 2017, into 2018, I left the company that I have co-founded, and I started my own practice on a whim. I had no idea what I was doing, and I decided to just open my doors and tell people that I'm seeing patients. At the same time, I was also a professor, a clinical instructor at Columbia, and a full-time resident. So I was spread thin. I was almost working 4 to 5 jobs, working every day, right? And then no one talks to you about these things to get to where you are, right? In 2018 ended, I continued 2019. I finished my office. I was very fortunate to have met awesome business partners. And without them, I could not be where I am today. We bought a practice and we also built a practice at the same time. So right off the get-go into 2018, 2019, I had bought a practice and I started a practice and I started a management company. So that's three things that I was starting. And the idea was to start to organize our systems and our workflows and our business. And after that, 2019, 2020, 2020, bought another practice during COVID, and I started another office within there during that time, and I no longer work for someone. So within that 4-year timeline, it's crazy to say that I no longer work for anyone other than myself, and I work for my employees. But that also comes with time. Now, the reason why I say Dentistry 101 is that my route is very non-traditional still. And I don't want people to aspire to be where I am. I want people to aspire to where they're going to be. And this is my personal interest. And I want you all to be passionate about what you want to do, because this is my passion. Doesn't mean it's going to be your passion. So this is the office I worked at. This is the office that I have. And this is the other office in Hoboken, New Jersey. This is the waiting room in Hoboken. The view of New York City skyline from our penthouse rooftop. And then patients get to see it here, and they can walk outside during the summertime. And this is the New York City financial. If anyone's in New York City, this is financial district right here, Wall Street area. This is the Freedom Tower. And this is my New York City office. Retail space, we're Invisalign studio. This is our clinical area, our waiting area, one of our chairs. But let's make it clear, it's super stressful. It's never that easy to achieve where you want to go. The amount of years you put in, the amount of time that you put in to be a doctor, to get your MD, to get your DDS, to get your DPT, whatever it is, anything that you're trying to achieve that's more in the healthcare space, it is stressful. And that stress is everywhere. And it's all about how we manage that stress. People would think that life at dental school is like this, right? Where you're just pouring champagne everywhere and then life is great. You're making all the money in the world, but it really is about kind of being in the dark sometimes. We don't know where we're hitting. We don't know where we're going. A lot of the times we shoot an arrow in the dark and say, hey, are we going to hit the arrow? Are we going to hit the target? Big question mark. We oftentimes miss. Sometimes the next arrow that we shoot, will we hit or even land the landing area, right? And it's not that easy to say that, this will happen in a heartbeat. It will happen tomorrow. And if I tell you all that it took me years to get to where I am, it took me almost a decade to even get to where I am remotely. So I want you all to start thinking more of the long-term solution than the short-term gratification. And a lot of times we think that once we could get out of school, we think that we're the best of the class, best in class. We try to aim to get this left side image where, this cupcake looks amazing. And then we get this instead, a gooey muffin, I guess, cupcake, whatever it may be. And it looks like this, and we nailed it. But we have to appreciate that and be humble with where we are and where we're going to be. So a lot of the times people forget, we always think about what's in front of us now, but we forget to reverse engineer. When I talk about reverse engineering, it means about thinking long-term, thinking about what you're going to be in 5 and 10 years, even longer than that. If I were to tell you now, personally, I had this conversation with my operations manager, I don't know where I'm going to be in 5 years' time because I've pretty much accelerated my growth. I've met my 5-year goal, but what's next? Because in order for you to understand where you're going, you have to understand how you're going to get there, and that word there is a destination. And where is that destination for you? So you have to understand, why am I doing what I'm doing? What's the long-term plan? Am I going to help people? Am I trying to open a business? Am I trying to do this? Am I trying to do that? And that's an answer that that's a question you have to answer for yourself, because it gives you a long-term vision. It gives you short-term motivation, it gives you concentrated knowledge acquisition, and it gives you momentum. So the moment you know where you're going to go, you have this sort of philosophy, you have this vision of being able to acquire knowledge, to move as fast as you possibly can and get to where you're going to be. But if you don't know where you're going to be, then what's the point, right? So if we keep moving forward day at a time and hoping for the best, then we're not probably designing our path correctly. And it's okay to be thinking 5 years down the road and your plans change, because if you are committed and passionate about where you're going to be in 5 years, it doesn't matter if your journey goes sideways a little bit. It doesn't matter, because at the minimum, you're in the right direction, and whatever comes in your way, you can navigate and you can tackle. So I'm a huge fan of reverse engineering, especially as you start becoming your own business owner one day down the road, or you want to be, a dentist or any healthcare professional. You can sit there and say, what's the outcome? Why is this patient feeling this way? What am I going to do with my business, or whatever question you may ask? And how am I going to get there? I need to know how I'm going to get there. I need to plan for it. I need to give you a solution, right? So relativity. Success is a relative term. It brings so many relatives. By Stephen Hawking, rest in peace, is that people may say that I'm successful. And I disagree, because success is such not a universal, it is a universal word to use, but it's such an overrated word to use, because people forget that success is so variable and it's so relative, that for me personally, success is, there is no destination. And for me to achieve that sort of perfectionism lifestyle will take me years and ages to get there, but I will never really truly get there. But again, it's a relative term. So I talk about this because people want to go into dentistry for the sake of being a dentist sometimes. And I want to challenge that mindset, because one of the biggest questions I have to ask you to ask yourself is, what is your why? Because it defines how you're going to get there. It's your guide. And what are you going to do to get there? Because if you don't know how you're going to get there, then what's the purpose? What's your vision? And I kind of loop back this concept of, reverse engineering, right? Because if you know why you're doing dentistry, and I'll tell you the reason why I went to dentistry. I went to dentistry when I was 19 years old. I was a sophomore in college. I was interning, and I sat there as I was interning, and I said to myself, I'm not so sure why I'm actually in this room, because I don't know anything about dentistry. But my mentor at the time said, at the minimum, build relationships. Understand why dentistry is more than just doing dentistry. Understand the fact that dentistry requires building relationships and building trust. So I spent my time during my internship learning how to build trust. I was a very introverted person. I didn't start or strike conversations until I was put to the test where I had to. And as a result of that, I blossomed, and I realized this is a great opportunity for us to make a difference. And that's the reason why I do what I do. Not only that, but in New York City, at least, dentistry is extremely expensive. And what ends up happening is that there are a lot of people who need the dentistry, who need work to get done in order to be healthy. And if financial commitments is going to be a barrier to entry, I would love to decrease that barrier to entry. And as anyone in this room may know, that then going to the dentist is, not the most exciting time of your life. They don't look for the appointment to go to the dentist, right? But if we challenge that concept and say, what's your why? Let's redefine that. Then perhaps we might challenge and enter dentistry in this field with a lot more clarity. And I'm hoping that today you get more clarity and not the dentistry. Because some people love dentistry, some people hate dentistry. And that's something that you have to answer for yourself. So what is my why? I know my why. What is your risk tolerance? What are you willing to give up to get to where you're going to be? And I want everyone to focus on delayed gratification. Everyone focuses now, especially these days, on immediate solutions. I want this now. I can go to Amazon. I could go to Amazon Prime and get 1 day delivery, like 1 day shipping, or even 1 day delivery, or go to buy clothes online and get it immediately the next day, right? But that immediate gratification poisons us, right? Because we think so much about, well, if it's in our hands, why not get it immediately, right? But why not commit to understanding that we may not get the things right away. We don't know the commitments and investments that we've made for ourselves. But you know what? That might take years for us to understand why we made that commitment. So what is your why? If you understand your why, you know what you're committing yourself to. But at the same time, understand how to set realistic expectations, right? Because we can dream the world and say, hey, down the road, I want to be the best surgeon in the world. I want to be the best doctor in the world. But you know what? There's so many bests out there these days. What's your best? What's your why? So that at the minimum, you've met your expectations. So dentistry is very much like this meme where you get a migraine, you get this headache in your head, you get a stress, it kind of goes all over the place. You get hypertension, you get a little bit more pulsating, headache in the end, and dentistry is everywhere, right? It is stressful, especially where I am, it's extremely stressful. But it can be a headache sometimes, right? But let's talk about what, aside from all the headaches that we have, let's think about what we can do for people, right? Here's a great example. I did a cosmetic case here where you can just kind of see when I talk about gingival inflammation means gum inflammation, right? You can see the kind of reddish hue that kind of circumscribes the areas of your teeth, right? And that means it's unhealthy. It means it's inflamed. But as you can see, my final result, although you can see that these two teeth are big and the center of the tooth is off, you can kind of see the redness goes away, right? That means that we've been able to achieve and improve the oral health simply by removing all this schmutz here that's actually causing it and providing them with a more aesthetic solution, but not as the aesthetics part, but even a more biologically healthy solution where there is minimal inflammation around his teeth. So in turn, he's healthier. His gums are healthier, flossing is going to be easier, less bleeding, higher success rate. And these veneers and crowns that I've made for him, they're there to stay, right? And of course, when he comes back home, he's gonna look happy. Here's another one right here, where he was trying to play doctor at home, where he had this rubber band that he had when he was younger, and he said, you know what, my teeth started to shift. I wanted to put them together. But so he puts a rubber band at night, closes the space, and it opens up again. And you can see all this little brownish hue here. It's all decay. When I talk about decay is cavity. It's extensive cavity. So instead, that same day, I said, listen, just don't do it again. Let me tell you what I'm going to do for you. I'm going to remove that rubber band. I'm going to make sure the teeth are nice and pressed together. And I'm going to take care of your cavities. So the same day, I was able to get this result to this result. It's a pretty good day for him. He's going to look nice and look happy, no more rubber bands, and he's going to have a nice smile. Let's talk about this case here. Before and after temporaries, this patient here, she was from Turkey. She got it done by a Turkish doctor, and these are crowns. And when I say crowns, they're basically caps that kind of are placed over teeth that are reduced in size in order to replicate natural aesthetics and dentition. And this is what she came in with and say, I lost it because I was at the beach with my kids and the wave hit me in the face, and then crowns are no longer to be found. And here I am saying, so you mean I have nothing to work with, right? So I have this to work with, and I have to get something like this at the minimum, something somewhat aesthetic, so that she can walk home without something, like having something to wear. And this is a pretty decent aesthetic outcome, right? Even here, like I talked about before and after, she can go home happy. Dentistry is great, right? Dentistry, you have the opportunity to make differences right now. You have the opportunity to make changes in people and make them feel good. You have the opportunity, not even through the dentistry that you're doing, but you can do it through your demeanor, your care for people. And that's one of the biggest things that people forget, is that dentistry is not about doing dentistry. Dentistry is about being able to provide solutions for people and make them happy. It doesn't mean that we have to be aggressive with the work that we do. We just have to be honest with the work that we do and provide great solutions. Even here, same day, 17-year-old, teenager, going to college, and said, hey, I want to close up the space. I don't want to do braces, right? And before and after, I said, you know what? Let me give you something new, at least somewhat better. You don't need braces, but let me close up the spaces, right? And here, same day, did a little bonding, et cetera, and here you go. Pretty good result for what we were working with, and she can go to college, right? This is the case that I brought in. The patient came in late, but this is the case I presented earlier. Is how do I get this solution from this scenario to this scenario here? So what I did was I used multi-layer bonding. Bonding is a composite, and when I say composite, it is typically generally referred to as filling material. Now, I remove everything that we do, and I put multiple layers of filling material. And these layers of filling materials are specifically have different opacities and densities of color, because at the end of the day, you don't want to put one monochromatic. Monochromatic is one shade, one color, just to cover this area up. You'll see a great discrepancy in the way he smiles. You'll be saying that, oh, this is something that's unnatural, unesthetic, because it's fake. The goal of dentistry sometimes is, how do I make fake look real? And how do I manipulate that? So I manually manipulated the color by having different shades. I have A to D, A to B, A to E. The details are insignificant, but how do I achieve an aesthetic outcome and at the same time make it look natural, right? That's what dentistry is all about, natural. You don't want to look at someone down, have your family member smile at you and say, hey, those look fake. How do we make things that look fake real, right? That's another form of dentistry. That's cosmetic dentistry. There's different kinds and forms of dentistry. There's surgery, there's cosmetics, there's orthodontic when it requires Invisalign and braces, metal wires. There's so many different forms of dentistry, right? But that's something for you to explore. Here's a great example where I was working with an orthodontist, and he's trying to get married, where you have this, he presented with this, and I mean, most people would say it's acceptable and aesthetic, right? But what about now? I drew these little lines here just to show you the level of his gums are just kind of up and down like a roller coaster. And this is where this is such an exciting time, because we can work with orthodontists to kind of manage this. Side view. And he says, I'm going to get married. I have to go to Belgium. I'm going to go away from a honeymoon, and I need veneers. I got to look good in pictures. As you can imagine, the level of stress that I have to navigate as he's getting married overseas before COVID, obviously. And he wants to look nice for pictures without it ever breaking off. And that was my biggest concern, is what if it broke off as he's in a honeymoon or he's at his wedding, God forbid, right? So from here, I was able to achieve another outcome for him. And I said, okay, great. As you can see that the levels of the gums have kind of stabilized ever so slightly. It's more level, it's pretty symmetric. Is it perfectly symmetric? No, but is it more symmetric? Yes. From before and after, you see this little spacing between his teeth. That's his up close view. And I said, all right, let's go ahead and go to your wedding. Removed all the little bumps on his teeth, kind of polished it down, did a little really minimally invasive sort of dentistry on him, kind of reducing some of the surfaces of his teeth, and got him a result like this, where again removed it, kind of make sure that everything's nice and polished, gave him something like this to go home with. It's not a bad aesthetic solution immediately for the time being. And I'm back. So he comes back, he said, I need new temporaries because I'm in a new phase of my Invisalign, and I want new ones. So again, as you can see, from here to here is drastically different, right? So the orthodontist I was working with opened up the space some more, right? You can see it's getting wider. Again, to create a better result, we have to create space. Dentistry isn't about just let's put nice things on people's teeth and make them, and you can go home and look nice. It's not about that. What's really exciting is how do I do the least amount of work, and to get the best results, right? So the orthodontics continue to do more work, and this is the before and after, right? Not bad. And these are temporaries. And again, same thing here to here, just temporaries. Because at the end of the day, we want to move everything first, and then we revisit and finalize. So during the day, everything's good. The orthodontist says, I think this patient's ready to rock and roll. Let's make him look nice. So here I am. I finalized his preparation. When I say preparation, reduction of his tooth. And I minimally did it. So you can see there's not too much removal of natural tooth. They're all natural, and no anesthesia whatsoever. Use my appropriate diagnostic information and created this result from here to here. And this is the story for him, from here into here. He was more interested in flatter smile. And this is why dentistry is nice, right? Dentistry is customized, it's personalized. There's no one size fits all solution. It's about being able to provide the solution that's customized for that particular patient. Am I happy with this? I wasn't personally happy. Am I happy with this more? I'm a little happier with this. And again, these are temporaries, and these are the finals. Now, it's not about what we want. It's about what they want. And we have to listen to what patients want. And if we start imposing our philosophies and what we want for them, it's not going to be a great solution for patients. So from here to here, from an outside in looking view, it looks nicer, like pretty, wide. His teeth are wider, it's more uniform. The midlines are corrected. His bite is stabilized. And I can happily say for the past 4 years, he hasn't called back to say, hey, my veneer popped. When I say popped, it popped off because of functional stress. But, I want to open the floor up more for you all to ask questions, because the clinical aspect of dentistry is so abstract. But I want you all to ask more questions to understand what you want to hear about the profession. So in the end, it's always worth it, because if you commit yourself to passion, if you commit yourself to what you're trying to achieve, it's always worth it. So for me, quality is not an act, it is a habit. So when you're graduating and moving on to your career, I want you all to trust the process. You're exactly where you need to be. There's no timeline. There's not a race to get to be the best, but you just got to be exactly where you want to be. And you got to be the best person that you have to be, best student, best clinician, and just always have a call to action. Make sure that whatever you're doing, there's something for you to look forward to. There's a plan. Grow, commit, and be comfortable being uncomfortable. So again, when I asked, what is your why? Here's my why. My purpose is defined as the ability to inspire and to gather inspiration from people so that they can share a similar fire of inspiration to inspire others. So what is your footprint that you want to achieve? Again, this is such a philosophical question, but this philosophy is what's going to keep you grounded and driven. But continue to improve, always improve. You're at the perfect time in your life where you're always focusing on the next steps moving forward. But as you move to the next steps, think about how you can improve that next step and continuously think about that. Because at the end of the day, if it's worth doing, it's always worth overdoing. Everything you do is a seed you sow. Seed bad, harvest bad. Seed good, harvest good, and the list goes on. So, any questions?
Yes, thank you so much for your presentation. We did have quite a few questions in the chat, so we can go ahead and get started. Also, I would just like to invite any students who want to unmute and ask their questions, go ahead and use the raise hand function, and the co-host for today will be happy to call on you. Okay, so One of our first questions came from Shannon, and that was, does majoring in something that is other than biology for an undergrad prepare us for dental school or the DAT exam? How hard was the DAT exam for you, and how much did you study, considering that was that maybe you didn't have a science major as a background?
Great question. I was back in the day, a few years ago, I was actually part of the Columbia Dental Admissions Committee, so I'm able to speak on that behalf. As far as the DAT goes, it's of course extraordinarily intense. It's not like walk in the park, right? Especially being an economics major, my focus is not on science. My focus is actually on economics. No matter what, dental school requires you to do prerequisites, and if those prerequisites are non-negotiable, you take them, you have to take them. In order for you to take them, you just got to get it done. Now, personally for me, I love the fact that I was not following the traditional route where I was taking science, because I think I was able to excel in the field. I was able to focus not on all the science that I've learned, stress out on all the things that I wasn't able to control. And whereas when I was studying my economics degree, it was a lot simpler because it gave me that fine balance between economics and biology and a lot of science courses that I would take. Now, in terms of DATs, the nice thing is that all you need to take are the classes that you need to take to get to dental school: bio, orgo, physics, whatever it is, biochem, and that's it. I need to know just all that information and not more than that. So in my opinion, to counter the non-traditional route, I actually like the fact that I was non-traditional because I only needed to study the things that I was required to study for this DAT. And that's how I was able to be successful. I spent around 3.5 weeks studying for it intensively in college.
Awesome. We have a student who wants to ask a question. Ashley, you can go ahead and unmute and ask your question.
Yeah, so I heard that you said there are dentists who are surgeons. So do those surgeons have an MD and a DDS, or yeah?
Great question. So in the dental field, one thing about the dental field that medical does not have is that we have the opportunity, as you're a dentist, you can get your MD after as well. If you become an oral maxillofacial surgeon, you would require another 6 years after dental school to get your MD. And through that track, when you go to medical school, I've had friends who are actually plastic surgeons who are dentists because they went to dental school, they went to residency for 6 years, and during that time they had to get your MD, and they went to medical classes again, medical school, got your MD, and after you got their MD, they went to plastic surgery, and they do cosmetic surgery. So it is a very different, vastly different. There are different kinds of specialties out there, and you could become literally a medical doctor or surgeon than a oral maxillofacial surgeon.
Shannon has a question regarding financial aid. So she's asking, what kind of financial aid can we get for dental school? Does FAFSA give out grants for dental school? Can you get a Pell Grant for dental school?
No, but wish. Yeah, dental school is expensive, and I put it out there because dental school, it's loud and clear. There's no escaping it. It's an expensive journey. If you want to be in it, you will be in it. There is minimal grants involved, and especially when you talk about Pell Grants, I remember Pell Grants being in college. It's been over a decade already almost. And there's not a lot of that. A lot of the financial aid is through the federal government, as well as from the private institutions themselves, such as Columbia. They have their own loans, or there are other alternatives, such as looking for private banking institutions, like your own personal banks for loans. And of course, with that comes with higher interest rates. But the reason why dental school is expensive is because dentistry is a very lucrative profession. With that being said, it also comes with a lot of expensive things to buy, and that kind of counters it.
Thank you for your insight on that. So another one of the questions we had today was from Via, and they asked, How has wearing masks and the COVID-19 pandemic impacted your practice in dentistry?
Initially it sucked, and I'll put it bluntly, because dentistry was known to be one of the highest transmitting. When I say known, it was hypothesized to be the highest transmission sort of transmissive sort of profession, because mouth is open, aerosols in the air. But research has now shown that there's less than 1% of the dentists who actually were exposed or been exposed to COVID or transmitting the disease. So few and far between. I feel like my practices, I have 5 practices so far, and none of my patients have any concern with the pandemic. And if anything, the patients themselves are responsible prior to coming in. So there is a mutual respect of the pandemic and the current situation. Again, I feel like it's no different, other than having my mask on all the time. But to perform dentistry, it hasn't changed. In fact, dentistry is booming actually instead.
That's great to know. Tenzin asks, how was it financially when you were buying your own office?
So I guess some people are interested in the business side of things. How was it financially to buy my own practice? Well, let's say I was lucky to have had the backing of my business partners to participate and leverage debt and leverage the risk. So through risk management and people that you trust, there's a lot more comfort knowing that this is feasible as a solution. My office that I built at the same time, I took a loan out, and then my other office that I bought, I self-financed it. In the term in startup life, it's bootstrapping. So we bootstrapped it. We injected our own financial capital to purchase a debt. Now, one of the biggest takeaways, and I don't want to impart too much investment options or strategies, but dental practices have been consistently growing every year. If anything, dentistry has never dipped down, and that's the highest return on investment you can make, is a hard asset growth, that it can grow not based off the projections of the economy, but more about dentistry as a concept, as an industry.
Thank you for giving some insight into, I know, a topic that not everyone wants to talk about as far as finances. Another question we had was from Shrenik, and they asked, how is your perspective on business played an important role in your career as a dentist? And so how has that background kind of helped you or shaped you?
Well, I was always interested in economics when I was in high school. So economics has always been a thing that was, if it were not for dentistry, I would have been in finance. That's clear and simple. And I've always had a keen interest in business and being a particular own business owner one day. And I was very lucky to have met the people who were also equally interested. Now, did having a degree in economics help me become a business owner? No, but did it help me understand that business am I more oriented from a business mindset? Yeah, I think I'm definitely more oriented that way as a result of me learning about the economy all the time and learning about businesses and learning about financials. But it is not a direct relationship whatsoever.
So Catherine is asking, what is the difference between a general DDS and an orthodontic surgeon DDS?
There's no orthodontic surgeon DDS, there's orthodontist. The only difference is orthodontist is just strictly limited to orthodontic work, which is braces and alignment and fixing malocclusion. When I say malocclusion, is the way people function through metal wires, through Invisaligns, clear aligners, whatever it may be. They focus on moving teeth, whereas surgeons place teeth in the mouth. There is a clear distinction, and the training is very different as well. So there is no orthodontic surgeon as much as there is being an orthodontist, unless you become an orthodontist and a surgeon.
If you want to spend that much time in school, go for it.
That's a good 10 years after dental school.
Yeah, we definitely need some financial aid for that one.
Yeah.
So, okay, Shannon was also wondering, what is there specific education that you need to become a pediatric dentist? Do you need more education after dental school in order to specialize in this?
Yeah, so every city, they all have their own specific requirements. Is it mandatory that you have to be a pediatric dentist to see kids? No. If you're comfortable knowing that, again, you have to, stay in your lane and provide a scope of work that you're comfortable at. Will you be able to know everything about pediatric dentistry? No, because you weren't trained in it. I'm a general dentist, and I call myself a restorative dentist. I do a little bit of everything. I do surgeries and everything else. Does it mean that I want to see kids and I'm comfortable seeing kids? Yes and no. I would love to see kids, but will I know what are abnormalities? I don't know that because I haven't seen enough in volume to understand and be comfortable providing that treatment to kids. Now, pediatric dentistry is a specialty. It's typically 2 years long. Sometimes some are 1 and some are 3. So it does vary.
Thank you for answering that. Toby asks, what resources did you use to understand the business side of owning a practice? And she also wanted to know if your previous knowledge from your economics degree helped in that.
I wanted to, when I was 19, I said to myself as I was interning that I wanted to own multiple practices. I wanted to own and manage 5 practices at the minimum. And I'm lucky to say that I am there, but it's extremely hard after the fact. It took me almost over a decade to get there. But that was, again, that's why I talk about reverse engineering. I wanted this when I was 19. I wanted to get to where I am today because that's my personal vision and my personal goal. This is what I wanted to achieve for myself because I knew that if I could do my business and if I could have an office that would be able to provide dentistry for a more affordable rate, not by sacrificing quality, I'm going to do that because that means I'm increasing the access to care to people who actually need it. I'm increasing the access to care for people who deserve it and want it, and eliminating the barrier to entry, which is cost. So if I can remove that and have people say, I can be healthier today because now this is within my range and budget, that makes me happy. So I focus that vision and I drive that vision across my offices with my partners. And we've been very fortunate to know that it's been working out for us.
That is a good, it's a good hope for all of us who expect to spend lots of money and time and dedication into going into these healthcare professions. So good to know there is a light at the end of the tunnel. Sierra was wondering, what is the best route to acquiring internships and shadowing opportunities during college and pre-graduate years?
Well, if you're local, as local dentists that you have done your research on, I was very fortunate. I was on LinkedIn. I reached out to a colleague, and who was my mentor at the time, and he welcomed me with open arms. And I was very fortunate to have been able to receive that care. And the reason why I say internship is so important is that it's about first understanding your criteria. Like, what do you want from an internship? Is it that you want to learn about dentistry? I was very fortunate. When I say ignorance is bliss, that cliche, it could not have been more prevalent to me and more meaningful to me. I did not go into the internship with any agenda whatsoever. I went to internship for exploration, discovery. And through that discovery phase, I realized there's so much more that I would want for myself in this profession, right? And I was very fortunate that my mentor at the time said, think about dentistry as a social science and a social profession. It's not working in people's mouths. It's not about that. It's about making people feel comfortable and they trust you in their treatment and knowing that they will come back to you because they know that they're going to get the best care under your treatment and your care and your hand skills and whatever it is, right? That's what I found more meaningful to me, is that how do I create that environment of trust where that patient loyalty will be self-cyclical and self-sustaining. That was my vision when I was younger. And I was very fortunate. I have met that guy who focused on that. But internships, you don't have to go into internship and stay in an internship. It's important to be diverse and address that and see more of that. So explore different kinds of offices, because that's kind of, that really sets you up for success later. And if it were not for who I have met at the time, I would not be where I am, because maybe I've experienced things differently. Maybe it is a dentistry, right? Versus the social part of dentistry.
That's a great answer. I think all these aspects to dentistry are so important, and internship allows you to explore different ways of what you like and what you don't like. So moving on to another question, Aster asks, what ethical issues have you ran into with patients who want extensive aesthetic work done, but it is not what is best for their health?
I tell them, go seek a second opinion, and here's my recommendations. And I personally am not comfortable doing this because I don't believe in the work I'm doing. Again, I did not go into dentistry for the sake of making money. I went to dentistry knowing that if I was going to make someone happy and do the best care, I was going to do the best that I believe, because those are the treatments I believed in. That was within my scope of care and my comfort. I have had many patients who want full mouth reconstructions, and I would look them dead in the eye. I said, I think this is not for you, but if you're looking for another opinion, I would recommend that. And you can seek that opinion from someone else, but here's the reason why I don't want to do it, because of blah, 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 right? And I told them straight. I mean, there's no reason why. You know what? One of the biggest things I've learned in life is learning when to say no, right? When you know how to say no, then that's when you know your boundaries. A lot of the times people want to say yes because it's financial. You know, you get this sort of income from patient, or you're just profit from patient. But I'm not driven by profit. I'm driven by predictability. I'd rather be predictable than to deliver, quasi good work, right? So manage your own quality.
Thank you. It's a good good to know that you can still draw the line. You can say, you can still work by your morals and your practices. And I think that's I'm sure you found that you're in a unique position at some point as far as owning your own practices and having that that ability to say so. So I think that's really nice. So another question we had was, how did you manage all of these extracurriculars, all of these different initiatives you were working on as you were still in school and in residency and doing all of this? Because you mentioned quite a lot of accomplishments, starting a tech startup, owning private practices, and as well as interning, residency, all of these things. So how is your work-life balance been?
Well, we say work-life balance, more work than it is life. And there's those sacrifices that I had to make, right? And people talk about success, right? If one of my friends, we were just having coffee the other day, and she asked me one of my biggest regrets. And my biggest regret is not understanding work-life balance earlier, because as much as I have gone far in where I am in terms of my career, there has to be a balance there too. And I say that openly with vulnerability, because it's important to know that it's not about where you're going to be and how fast you're going to get there, because you lose yourself in the process of doing so, because you get so addicted to just getting it done. And once you get that addiction, you just want more of it, right? And I'm lucky to kind of be self-reflective a lot of the times to understand that. Now, how do you manage it? Of course, you sleep a little less. You sleep a little less, you build a great routine. That's what it is. One of the biggest, I read a lot of books on leadership and management and self-reflective books and self-development books. And it's really about management, self-care. And self-care can be manifested in different ways, right? Some people like to go to the gym. Some like to meditate. Some people like to, drink coffee in the morning, whatever that self sort of routine. I think one of the biggest things is having a routine, understanding what's predictable. So when you hone in on those extracurriculars or whatever it is, you know that you're going all in, and you're not jaded by fatigue, or you're not jaded by the work that you have to do. You're not jaded by what you've been able to what you have sacrificed, and look back at it. Yeah, did I sacrifice a lot? More than most people have. Now, do I regret it? No, because I, at least at the minimum, can manage my next few steps, right? So I think that moving forward, it's not about current management. It's about managing yourself for later? Are you able to manage yourself later? Are you able to manage your social life? Are you able to build great relationships later? That's really more, actually, to be honest, more important, right? When do you draw the line for yourself? That's where you can manage yourself. And I've been able to manage my social relationships, my personal relationships, my professional relationships, anything like that, because I knew that if I was going to commit to doing something, I was able to cut back and manage that time.
Another question we had was, what is your biggest challenge as a dentist regarding patients?
One of the biggest things, don't get sued. Is there the biggest challenge? One of the biggest challenges, okay, that's one thing. That's hopefully no one has to have to get to that point where it's, malpractice is a concern. But one of the biggest challenges, you can't please everyone, all right? And that's why you have to start setting expectations clearly for yourself and for others. Just moving forward, just even everything that you do in life is, what do you expect from others? What do you expect for yourself? And so this way, at the minimum, you have something to meet and look forward to. And that's one of the things I like to kind of drive home is, what is that expectation? Sometimes, the question was about extensive aesthetic work, right? Yeah, I can do a nice case, break my back a couple, charge person a lot of money to do so. But you know what? One of the hardest things is saying yes to that and not meeting their expectation. Because if you really care about patient care, that would make you not sleep at night, right? So it's one of the biggest challenges, when to say no to people, even though you feel like you're trained to do so, you can do this, you can do that. But it takes one experience for you to say, you know what, I'm gonna tap out. I'm gonna give to someone else who can handle this. So it's not one particular case, it's a general concept.
So another question we had was from Ayana, and they asked, have you had any negative experiences working as a minority in dentistry, and specifically as a member of the AAPI community?
Personally, no, I've never have. It might be the fact that I'm in New York City, where diversity is, New York is at the melting pot. I'm in New Jersey as well, but one of my offices is in the heart of New Jersey, next to, literally across the river in New York, from New York. And diversity has always been, there. I haven't experienced anything, fortunately. So I think that you have to be strategic with where you're going to be as well, because that's also a strategic business decision as well. So to answer that question very succinctly, no, I haven't had any experiences whatsoever.
Thank you for sharing that. So another question we had was, how many hours a week do you work on average? And since you have your own practice, are you able to adjust your schedule when you need to take time off?
Yeah, that's one of the nice things of having your own sort of thing, right? I clinically work 2 days a week only. So I only work Thursdays and Saturdays. The rest of the week, I can kind of manage myself do whatever I need to do. But that took me a very long time to get there. I used to work 7 days a week, and I would have maybe 1 or 2 days off a month for a very long time. But I was, again, very lucky to have met people and partners who have been able to provide that. So I have not been, I've been lucky to have had more time for myself.
Thank you. That's also nice to hear that it's not always going to be, 12, 14-hour days. There are 7 days a week. There is a point where, you can get to, managing yourself and doing what you want on this line with your values. So I guess another question going back to just kind of your school years, how did you decide where was best for you in terms of applying to dental school and the programs that you thought would be most suitable for you? Like, what criteria did you use to kind of evaluate that?
Well, good question. For me, it's where home is. Home is New York. I've been from New York and I want to be close to home. Number two, I'm comfortable with that density of people and demographic. I have not experienced living outside of that, outside of the tri-state area ever. And I want to be around the same people that I'm comfortable being around. And I want to commit to myself in developing relationships and networks that are close and, very near and dear to my heart. That's one of the biggest reasons why. It was financial concerns part of the thing. Yeah, I'm sure it is, but there's only one chance for you to get a DDS from, right? That's one thing people to think about. And when I had gone to dental school, my dad said, where would you like to go? Because this is the only time you're going to get a doctorate. And I said, you know what, I'm going to go to Columbia. And I was like, why not? I went to school at NYU. I spent a long time at NYU already, 4 years. I'm not going to spend another 4 years there, plus maybe more potentially. Let me just diversify my experiences. And that's the only reason why. People have different, preferences too, significant others. I don't have any significant others. So and my decision was solely based off what I personally wanted.
That's great. I really get how staying in your home and your own state is really comfortable, especially when you make these big decisions of going into your own practice. Another question we had was if you had an exciting procedure you performed or a procedure that you really like when you perform it.
What would I perform? Or what is it I would perform?
Any procedure that is exciting, I guess.
Everything's quite exciting as you're a general dentist, right? Because you can do filling, you can do a crown, you can do surgery. Everything's quite exciting. Now that I don't practice as much, I focus my practice mainly on just like surgeries more. I've been focusing more on the surgical aspect of things, so I've been happy. That's what I limit myself to. More or less now these days, but sinus lifts are fun. Lateral sinus lifts, and when I mean sinus lift is that sometimes this area here, I be underneath your nose and right side lateral to your nose here. There's like this window of when you get congestions in allergy season, right? That area gets kind of congested. And now sinus lift is basically how do we enter that sinus and lift the sinus up. To accommodate for implants in the future, surgical implants, right? And sometimes it would require us to kind of, make incisions from your gums and kind of pull it back all the way and lift up the area, drill a little window. When I say window, drill through the bone and kind of lift it out from the outside in. That's cool. It's fun. It sounds, sounds intense. It is intense. It's really invasive, but it's cool when you get there and get it done. Trying to do more of that actually.
That's really interesting to kind of hear how there's different, there's some things you don't necessarily associate with specifically being dentistry. You think of just teeth, but there's actually so much more, so many other compounding biological factors and situations that make these things up. So another question was, what is one of your most memorable cases and why was it?
So memorable cases where there's actually during COVID where one of my hygienists, she's from Romania, and she recommended this this guy, abrasive guy, and he's a full mouth reconstruction. Didn't really see the dentist, sheared out all his teeth. It was a tough case, especially as a macho guy himself. It was tough to manage that too. Again, dentistry isn't about working with it; it's about dealing with people. Plus that, did a full mouth reconstruction on him. Took a couple of implants. Took me a year and a half. But at the end of the day, no matter how abrasive that guy was, all he did was look at me dead in the eye during the pandemic, gave me a hug. He said, I know we're not supposed to do this, but I really wanted to share with you my sort of appreciation, making me smile again. And I really love you. So it's nice to know that. And I was like, oh, like it's nice and warm. I'm like, oh, you're just a mean guy in a very nice way. And we were able to just get him a nice smile. And I'm very fortunate to have that had experience. And again, is to be able to be trained enough to deliver that is probably the most exciting part, right? Because you can do it with your eyes closed, and I was able to do so. I was able to be predictable with my results. And dentistry is all about predictability. It's not about trying things. It's about doing things that you can do well at and keep doing it for others.
Thank you. That was so inspiring. For our next question, Matthew asks, that, do you have any last advice you would give to college students who want to pursue dental or medical fields?
Yeah, well, the last advice is when you're gonna do it, go all in at it and don't stop going at it, because a lot of the times you can get jaded through the process. 4 years is a long time, 4 years of college. And I remember when I first started dental school, I was like, when is it over? And then it was like the blink of an eye when it was over. Then you're like, I wish I was in dental school again, but we forget the process, like the process getting to, or to get your degree, to get to becoming to get your DDS. And we forget the fact that, we are not in dental school to just crank out treatments to graduate. We're in dental school because we're learning to be the best clinician that we can possibly be. And that means committing yourself to that and not be jaded in the process. So one of the things is just go with dental school. It is tough. Is it easy? No. Especially at Columbia, we took medical classes too. So we did med school plus dental school, and it was hyper intensive, right? So you do get jaded, you get stressed out, you completely get lost in the process because you don't think about dentistry. You think about study. You don't do until you get to the point where you're working on patients. You're like, dentistry, what's that again? Right? And don't get jaded in the process. It does happen. It does come.
Thank you. I really like that advice. So the question we had was from Rigoberto, and they were wondering, what thoughts do you have on a relatively new specialty in dentistry, which is dental anesthesiology?
Great profession. I have friends in there. A good friend of mine has a great anesthesiology group. It's a profession that is up and coming, if not already. I think it's a great field. If someone who wants to be in that field, who doesn't want to be clinically involved and kind of help others and see a wide array of dentistry. I mean, I have my friends, if you talk about the work that I do, this is minuscule compared to what they do. I'm talking about ripping everyone's teeth out, putting tons of implants in there, giving a new set of teeth in one day, and being able to be that provider, being an anesthesiologist, being that conduit for them to achieve that is an exciting thing too. You don't do dentistry for sure, but it is definitely something that is up and coming, and it's a popular field to be in.
That's relieving to hear. Rigoberto asks if you have any thoughts on the relative.
Oh, sorry about that.
Sorry.
So we were just wondering.
Rigoberto asks if you have any thoughts on the relatively new dental anesthesiologist specialty.
Sorry, that was just the last question. I think we had a Zoom glitch in the Zoom. That's all. So we were just wondering if there are any last thoughts or anything you'd like to leave us with, since it is almost time for the end of the session. We want to be respectful of that, but if there's anything that perhaps you wish you had known as you were going into the field of dentistry and being a professional, and anything you'd like to leave the students with in terms of that.
Yeah, I think when you get into a field and commit yourself, I always tell every student, when I was teaching at Columbia, just like, don't worry about the things that go wrong. Embrace the failures, embrace the things that go wrong. When I went to dental school, I'll tell you, I tell people all the time, like, I wasn't the best student in college. I got my C+ in biology for a whole entire year. I got a C. I'm telling you, because my lab partners at the time got the only reason why I passed biology was in my lab. I failed every midterm. I barely skimmed the final, and we forget that, right? And I say that very, very bluntly, openly, because it's okay to feel that you may not be able to get there. I'll tell you, I got a C+ in biology, and all my dental school said, what happened here? And I said, listen, it's one of the biggest things is not to just say, oh, I did bad, I did poorly. It's about the things that you learn from the process. So failure is great. Failure, it should be praised. Failure should be learned from. And we should just kind of appreciate that failure is there. Because if we don't understand how to navigate that, you're going to have a lot harder time later you get to your life in the future, where when you experience failure, because you know what, when I was at Columbia and I was in admissions committee, I saw tons of, I'm talking about stellar stars, like 4.0 students, 28, 29 DATs, unheard of, you know, the best students in the world. But one of the biggest things I always present to the committee was, what if things don't work out for this person? What if something happens down the road and failure happened, whatever that failure may be? Maybe it might be the fact I'm not a great clinician. Maybe, dental school is too tough, whatever it is. It's about how we tackle that failure that's going to drive us to excel, to accelerate our growth, right? I was very fortunate that I have experienced it earlier on, and I'm very happy to even share that, because you know what? If I didn't fail earlier, if I didn't fail if I didn't meet my own expectations, if I just didn't know what I was doing, we're never going to learn from it. We should learn from our failures in college. You know, it's okay. We're not perfect. We're all trying to learn about ourselves. We're all trying to learn how to study. Even in dental school, you're still learning how to study, right? And after dental school, you don't even know how to study anymore. But it's okay, and it's okay to fail. But if we are going to fail, use it as an opportunity to learn and navigate the sales and just, not experience it again. And will you experience it again? Fine, it's good. But you know what? The second time around, it's a lot easier.
Thank you so much for leaving us with that last bit of advice. And I really like that perspective. I really enjoyed your presentation today. I learned a lot. As somebody who doesn't have a whole lot of knowledge on dentistry, I feel like I got definitely more interested in the profession now. And I think a lot of students who came today got a lot out of the presentation too. So thank you again for giving your time and coming to present to us.
Absolutely. Again, if you guys have any questions whatsoever, my email is there, my social media is there. You can contact me. I'm very open to conversations. And again, I'm here as a resource, and I want people to know that you're not left in the dark. There's other people out there that you can reach out to, and I can be an extension of that.
Thank you. And it's invaluable to have professionals who are so willing to just come and give their advice, as well as be a resource for students.
Of course.
Okay, so I'm going to go ahead and get into our wrap-up presentation for all of my students here today. This is just going to go over how you can go ahead and log on to our website to take our post-shadowing assessment. Thank you again, Dr. Chen.
You're absolutely welcome. Thank you all.
Okay, so let's reflect on what brought us to the session today. What are 3 major takeaways that you got from the presentation, and what do you want to learn more about? Of course, we do not require that you respond to these in any way or even write them down, but it's just something that's good to think about, especially as we all move forward and we're eventually going to have to be writing personal statements, application letters. We want to think about, what got us to this point here today, what encouraged us, what inspired us, what professionals did we hear from that really shaped our perspective on medicine and healthcare in general. So even though it's not a requirement, if you do happen to write some of these reflection thoughts down and you want some recognition for them, make sure to submit your thoughts at prehealthshadowing.com/blog submissions. And Muntaha, who is our editor-in-chief and one of our lovely co-hosts here today, will give you some feedback, and you can get started and work on seeing how you can get your article published and maybe even collaborate with other students on similar projects. So if you are interested in being a part of pre-health shadowing, we are always looking for student volunteers as well as team members to come and join us and help us on different projects. So if you want to be a volunteer and work on asynchronous tasks on your own time, as well as network with other pre-professional students, you can go ahead and click the link that will be dropped in the chat and sign up to be a volunteer. If you want to play a more active role in our team, then we encourage you to become a team member. And you can be up here with us, have a cool background, that's always a bonus, and get more involved, be more interactive, start your own projects, take on grant writing, do some graphic design initiatives, different things, bring your own ideas to the table. We love having different perspectives and getting more students involved. There is no age limit or minimum to being a team member. However, we do request that team members our college students. If you are a high school student who wants to get involved, then you can definitely reach out to our chief of HTP, which is high school training for pre-health shadowing, to become more involved in those opportunities when you are a minor. And yes, one of our team members will send the links in the chat in just a moment. So if you can, we humbly ask that you donate. Again, we are a nonprofit and we are working tirelessly around the world and all the time to get these opportunities up and running and keep them free to you guys. We know that not everybody has the financial capabilities and everything to keep up with all of the competitive healthcare professional school applications and all of the requirements for that. And so we want to be able to give people these experiences at no cost. So again, we ask that if you do have the resources, you donate $1 to us. But of course, we understand that's not always possible. And we just request you spread the word about pre-health shadowing and our goals. So if you would like to earn a free digital certificate for attending today, then please stay tuned so you can take our post-shadowing assessment in order to get your certificate. So first things first, you're going to navigate to Dr. Chen's professional course page on prehealthshadowing.com, and you're going to sign up for free for the course. If you have not already made an account on prehealthshadowing.com, you can do that. It's easy, it's free, it's simple. Just use any email you want. It can be a school, it can be a personal email, and you get signed up for our weekly email list as well, so you can get updated on all of our sessions. Once you've done that, all you need to do is click the free Take This Course button under Dr. Chen's course page. Then go ahead and take the quiz. This is a 10-question multiple choice quiz, and you have 2 chances to pass with a 70% or a 7 out of 10 or higher to get your virtual shadowing certificate. These quizzes are open indefinitely, so you can take them whenever. We do kind of recommend that you wait about half an hour, 45 minutes or so until after the session is over in order to log onto the website and take the quiz, because we are aware of the high traffic on our website can cause some technical issues and connection errors and submission problems with the quiz, and we don't want anyone to get locked out for any reason. So once you've passed your quiz, you can go ahead and select the Finish This course and download your free certificate as a PDF. If you would like to go back and view all of your previous certificates, you can easily do that by clicking the profile icon at the top of the page and viewing the past courses you've completed. Of course, if you do have any trouble with our website or any of this, you can be sure to email us at info@prehealthshadowing.com and we will get back to you ASAP. So if you did miss a part of our session today or have missed any of our previous sessions, then we highly encourage you to either go onto prehealthshadowing.com or onto our YouTube channel and watch all of our previous sessions dating all the way back to September of 2020 for free. You may also take any of the post-shadowing assessments for these sessions as well, so you can rack up those virtual shadowing hours. Make sure to catch us for our weekday sessions going on through June right now, which is really exciting that we've been booked so far in advance. You can make sure to subscribe to our email list on our website, as well as follow us on Instagram and TikTok. We are active on both. So I just want to thank everybody for joining our session today. Please stick around if you have any questions. Myself or some of the other student team members will be here and happy to answer any questions or help you out with any technical issues you may be having. So thank you so much for joining today, and I hope you have a lovely rest of your night.